Hi guys, happy Monday! We're back again with another Medical Monday, and today we're talking about a really hot topic because I feel like a lot of people relate, or their family member suffers from anxiety, or they do. So we have had so many questions and patients that come and want to treat this. So we'll get into it.
That's right. I think everybody knows somebody with anxiety, or they've suffered from anxiety at least at some point during their life. It turns out that it is the most common psychiatric disorder in our country, and over 40 million adults suffer from anxiety. So it's something at Greenhouse Wellness that we do see quite a bit, is that patients come in and they say, I'd like to treat my anxiety. Sometimes when anxiety isn't treated, it leads to then depression.
Right.
It's pretty awful if you think about it, just feeling so unhappy in your own skin and just so nervous in your own skin.
Right.
It's a terrible disorder.
Yeah.
So we like to treat it, and we really like to pay attention to those symptoms and those complaints when patients come in asking to treat their anxiety. And happily, cannabis can help with that.
Yes,
Okay?
very much.
So what do you look for, right?
Exactly.
All right, so it turns out that we have developed something here at Greenhouse Wellness that's really helpful. A big shout out to Mark Simmons, who helped with this.
Yay.
But this is a wonderful chart that helps with disease states and then also cannabinoids and terpene profiles. So you can go right to anxiety on this list, and then it shows you exactly what you want to look for. And that would be CBD, or cannabidiol, CBC, and CBG. So you want to look for products that have those in them as far as the cannabinoids. And then obviously for terpenes, probably most people are most familiar with limonene, which is the aroma that smells like lemons. It's uplifting, citrus. So that's what you would be looking for as far as anxiety relief. That's the most common. And that somebody had asked a question of, well, how do I keep from feeling so sedated?
Right.
That's one of your uplifting terpenes. So you would want to be looking for cannabis that had high levels of limonene in it. Another way of treating anxiety, though, is to go the other way and treat with linalool, which is what's in lavender, right? And then oftentimes those strains also have myrcene in it, and that's another component or another terpene that will help with anxiety. So you can have your anxiety in the evening and be a little bit more sedated, and you can have your anxiety in the morning and then go with more of an uplifting strain. So we can help in both of those ways.
Right.
Okay, so we have some products here that we wanted to show you. This is a super common uplifting strain, very, very popular. It's called Super Lemon Haze. And obviously that's got the limonene going on in there. So you can definitely take a look at that. That's our Super Lemon Haze. So that's one option for morning. And then we have something that's really cool from our friends at Forward Grow. And this is called FG101. And these buds were very, very delicate. And so they chose to pre-grind it, which is actually perfect for a lot of our patients who can't be bothered. But this product can then just be put right into your vaporizer. It's pre-ground, it's ready to go. But what I love about FG101 is how high in cannabinoids and especially CBD this is. So this is really good. It won't make you high, it won't give you that cerebral effect, but it will just take the edge off. It'll take the anxiety away, which I really like. So we have a couple of different flower options definitely for our patients.
So what about people who complain that sometimes it can worsen like their symptoms of anxiety?
Yeah, and I do hear that, and usually that's because there's too much THC.
Right.
Okay, so if you overdose on the THC, that's going to make you feel paranoid or anxious, and that's why some of these other strains that are a little bit lower in the THC are so important when treating your issues. And that's why, I know you had posted earlier, Ciara, that if you're buying your product based on THC levels, you're doing it wrong.
Yes.
And I had a tear that went right down my cheek when I read that, because it's something that we've been saying for so long.
We always say that. There's a reason
There's a reason why we say this, and that cannabis is many things to many different people, and we need to have different options to be able to treat everything that is presented to us.
So Mary Carroll, I think you're referring to this. This is a strain called FG101. So I think that's what you were asking about. And it's just pre-ground.
And it's actually very pretty. It's just that the buds that this particular strain produced were just very delicate, and the fear was that they wouldn't survive the packaging and the handling and all of that, because some of our consumers are very knowledgeable and discerning, and we get that. And a lot of our patients too come in and they can't be bothered by trying to grind it or pick it apart with their fingers, and they like having pre-ground options. So that's why we have this out, to show the patients what this looks like. And then another thing that patients with anxiety are often asking me for, Ciara, is the disposables, the vaporizer. Those are just so nice to be able to have. They're very discreet. They don't have an odor to them. A lot of my patients will keep them by the bed. Now, Tangy is something that you're going to be using more daytime. So if you don't want to be sedated, this has the limonene and all of that. That's going to keep you uplifted. So another way to do it would be to take either a CBD-only vape pen or a cartridge that had more CBD or even linalool or myrcene in it, and you could use that for your anxiety at night. So these are another option. But then I can't stress enough, anxiety starts in your gut. And so you really have to pay attention to healthy habits. You really want to have the good bacteria going on in your gut. So I'm always talking to the patients about probiotics, girl. Yes, yes, yes. Eat fermented foods. Do what the most ancient societies have done for all eternity, is incorporate those kinds of food products in their diet. So yes, anxiety does start in the gut. Let's protect our guts. Let's eat a healthy diet. Let's take our probiotics, and then let's take tinctures. So if you can get some CBD, if you can get some THC, you can get those terpenes in right under the tongue and start medicating your gut. That's where you're really going to get a benefit.
That's how you do it. Corey's asking, can minimal THC along with CBD cause anxiety or paranoia? And can someone be allergic to any trace of THC?
Well, I have never heard of an allergy to THC, so that's a great question. Remember, our bodies are wired for THC. Our endocannabinoid system has receptors that are just absolutely designed to receive that THC molecule in there. Typically, low THC is absolutely not going to cause any anxiety, and that's what I would do if somebody was presenting to me and they said, hey, listen, I tried this one strain and I got really anxious on it. In fact, my anxiety got worse. I'd say, well, let's look at this and let's see if we can't turn that THC down. And remember, we're always telling our patients the antidote for too much THC is time, hydrate with water, and also CBD. If you have straight CBD, that's the most amazing thing, because it'll just disrupt that right off of the receptor and really get you feeling better. Just remember, it's not going to hurt you. Make sure that you are in a calm place, that you're not getting too much stimulation. Hydrate, give it a little bit of time, take some CBD. So those are really good.
I love that. And
options.
I think we had one more question. I'm just going to try and... Mary Carol asked about, she's been trying CBD concentrates, but she's not sure how to dose and how much is the most effective.
So I guess it depends on what exactly you're taking. So what I would encourage you to do is to come in so I can show you exactly dosing here. Sometimes I actually have patients go out and purchase on Amazon or whatever, just the measured with the gradations of eyedropper, so that you know exactly what you're getting, and we can help you with that. But typically an eyedropper full in the morning and at night, just under the tongue, of straight CBD is what I recommend. It depends, because some of the CBD oil is stronger than others. So just if you have any questions, bring in what you've got going on, show us, and our wellness consultants can educate you right on the spot and give you advice.
Perfect. And she's saying that she's tried Painkiller and the AC/DC cartridges.
And I hope those are working.
Yeah. And Corey has low THC flower but is worried about THC causing more anxiety.
Well, that's why you want to look for something, Corey, with the really low level of THC. I think that's perfect.
The key.
That's the key. And if you're nervous about it, then have some CBD oil on hand as a backup. But if you're on a low THC strain, I really wouldn't worry about it.
Thank you so much.
Thank you, Ciara. That's a really good topic, and one that we see a lot here at Greenhouse.
Absolutely. If you guys have more questions, just drop them below. We'll continue to answer. And I hope everybody has a great Monday.
Yeah, happy Monday.
Sending you all the good vibes. I know we're in selfie mode, so everything's backwards, but I wore my sweatshirt for this topic specifically.
Thank you.
Bye, Corey.
Bye-bye, guys.